Maybe what, after 1
You bring this thing to vote and send it straight to the governor to sign.
My patients come to me in the ER when their undiagnosed cancer is terminal, when their heart disease has become a heart attack, when their diabetic foot wounds have become full-blown sepsis. You know, that's why we need to pass the New York Health Act.
Imagine you have health care. It's easy if you try. Freedom to choose your doctor. No extra stuff to buy. Imagine first-class treatment when you're unemployed.
I don't choose to live in a world where a person hospitalized with COVID at death's doorstep is worrying about how they're going to pay for their health care bills. The Bronx, where I live, ranks 62 out of 62 counties in New York, dead last when it comes to health outcomes. We also have one of the highest combined uninsured rates and unemployment rates in the city. I don't choose to live in that world.
Imagine care for everyone. No greedy middleman. No premium, no copay. A single payer plan. Imagine long-term illness, but you don't lose your home.
In a land that is abundant with resources, in a land where there's an abundance of medicine and medical care, it is a crying shame if we allow people to continue to die when we have the resources that they need to live.
For the entire history of our country, housing segregation, discrimination, and poverty have produced disproportionate illness and death and deep and widespread health disparities among people of color.
I don't choose to live in a world where my loved one with Medicaid is denied access to a healthcare facility because their insurance is not accepted. I don't choose to live in a world where there are two healthcare systems, one for the rich and one for the poor.
You may say I'm a dreamer, but we have a commonwealth. I hope someday we'll join up and the world can live in health.
It's really important that we do this. It's really important that we lead the way so that I don't have to have this role. That my role shouldn't exist. I shouldn't be there helping patients and doctors navigate the insurance system just to make sure that people live.
Who you are, where you are from, how you look like, how much money you have. You are entitled to healthcare as a human right.
And budgets and policies have not centered living wages, nor voting rights, nor just immigration, nor housing for all, nor caring for the land and water and air around us, nor ending mass incarceration, nor our health care.
Pharmaceutical companies, to the health insurance companies, to the Wall Street billionaires and the politicians in their pockets. They have the money and they have the motive because this system benefits them and it benefits nobody else.
This is that we're going to walk to Albany and make it pass so that we can have single payer.